My name is Joel Ray. I'm a clinician scientist and professor in the departments of medicine and obstetrics and gynecology at St. Michael's Hospital in Toronto, Ontario, Canada. I'm interested in the subject of how fetuses and children grow and the contributions of ethnicity to growth. The reason I'm so interested is that in our multi-ethnic city and province where I live, like in so much of the U.S. and elsewhere, we have a large wave of immigrants from very different parts of the world who have babies who grow differently. When we look at how children grow, in this case in relation to weight, what we can see is the contribution of what we call additive genetic variation, which is really how genetics affect growth. So when we look at the red square, we can say that before a baby is born, about 20% of its fetal growth is related to genetics. When we look at the common environmental factors, the C-squared contribution, things that relate to economics, nutrition, and schooling, we see that in the blue square, the contribution of environment is very great just before the child is born at 60%, but then declines dramatically thereafter as the child grows from toddler to teen. So when we then think about how controlling the environmental aspects can affect the growth of a fetus, we go to the Intergrowth 21st Project and what they call the FGLS, Fetal Growth Longitudinal Study and Newborn Cross-Sectional Study. They proposed a universal standard for fetal growth that argued that under optimal maternal conditions, whether educational, nutritional, socioeconomic, that one can observe a similar and optimal pattern of fetal growth. They also only included women who had relatively controlled spectrum of body mass index and whose mothers were at least 153 centimeters in height. This FGLS Intergrowth 21st approach was prescriptive in nature, things that would be aspired to at the biological and individual population levels. And this was in difference to a reference curve which describes the distribution of fetal or newborn growth in one population at a given time and place. In Ontario, we've looked at the number of newborn males who would be misclassified as SGA if you used a Canadian-born reference curve rather than a reference curve specific to its mother's world region of origin. And what we showed is that for immigrant mothers who come from European and Western nations to Canada, there is no misclassification when one uses a Canadian curve compared to their own world region-specific curve. But when we look at African and Caribbean males, 67 per thousand newborns are misclassified as SGA when one uses a Canadian-born reference curve rather than a customized maternal world region curve. And for South Asians on the far right, 116 per thousand males are classified as SGA on a Canadian curve where they otherwise are not SGA on their own customized curve. We've looked at adverse neonatal outcomes when classification is on the Canadian curve compared to the customized world region specific curve, in this case for Ontario newborns. And what we can show is that the adjusted odds ratio is 0.83, in other words not higher for neonatal death when SGA is applied by a Canadian curve rather than a customized curve. However, when one uses the customized curve, the neonatal death odds ratio is 1.56, because we believe SGA is more correctly being classified by world region specific curves. And for other outcomes like hospital stay over 7 days or admission to the NICU, we see a similar pattern. But for mechanical ventilation or intrauterine hypoxia, we don't really see as much of a pronounced effect, regardless, in other words, of the curve that one uses. So we conclude the Intergrowth 21st FGLS-like project teaches us so much about how fetuses grow in a very internally valid way with excellent statistical and international approaches to methods. But it may not inform clinicians about how to measure normal growth of a typical fetus or the normal size of a baby at birth, especially for women who are shorter, heavier, or older, or who belong to certain ethnic groups who might not have been included in Intergrowth's 21st project at the get-go. So for the women who produce these children as fetuses and postnatal growing babies, we may need more data beyond what FGLS-like curves from the Intergrowth 21st can tell us. Thank you.